Real feelings of being stabbed. Stage 1. The moment of penetration, 0 to 3 seconds. The second a sharp tip pierces your skin, the nerve fibers in your outer layer fire at once. It feels like someone suddenly jabs a red-hot wire straight into your navel. Each layer of skin rips apart like tearing a Velcro strip. You won't actually hear a sound, but your nervous system registers it as a faint, sharp tearing noise. As the blade cuts through, epidermis, dermis, subcutaneous fat, muscle, and fascia, fat parts like butter under a hot knife, muscle fibers snap with a twitch, like rubber bands being snapped out if the tip hits a rib. It skids with a hard, dull click, like a fork scraping against the ceramic plate. Stage 2. Organ damage, 3 to 10 seconds. When the blade enters your abdomen, your body suddenly feels weightless. That's the empty drop you get when the peritoneum is pierced, like an elevator suddenly plummeting. If the liver is struck, a warm, iron-tasting rush surges through your right abdomen, blood mixed with bile. The pain is like someone popping a balloon full of hot red wine inside you. If the lung is punctured, every breath feels like sipping yogurt mixed with shards of glass through a straw. Sweet, foamy blood rises in your throat. A hemopneumothorax forms. If the intestines rupture, it starts as a sharp, electric pain, then turns into a scalding burn, intestinal fluid eating away at the peritoneum, causing acute chemical peritonitis. Your body begins to suffocate. Blood loss drops hemoglobin levels fast. You feel lightheaded, as if diving 30 meters underwater. Gray static creeps into the edges of your vision. Your retina starved of oxygen. A low, roaring sound rings in your ears, like the ocean inside a seashell, your inner ear struggling from reduced blood flow. Stage 3. Shock response, after 30 seconds. Once blood loss exceeds 800 milliliters, your body switches into survival shutdown. Pain doesn't disappear. Endorphins just turn the volume down to near silence, like screaming into a pillow. Fingers go numb and cold. Blood vessels in your limbs constrict, sending all remaining blood to your core organs. You'll feel a sudden, absurd urge to urinate, your bladder muscles losing control from oxygen deprivation. In your final moments, your senses warp. Time slows down, stretched thin by oxygen-starved brain. White flashes burst in your vision, abnormal electrical activity in the visual cortex. The smell of toasted bread fills your nose, a hallucination from a dying olfactory bulb. Little-known facts. Pain when the knife is pulled out is 3 times worse than when it enters. The blade drags tissue with it, causing a second, deeper tear. People dying from blood loss often appear to smile. It's not peace, it's just facial muscles going completely limp. The truly fatal wounds often don't hurt at all. If the blade hits the medulla oblongata or the heart's electrical system, death arrives faster than pain signals can reach the brain.